Here is a detailed and comprehensive explanation of the HPV vaccine. Basic drug information. Generic name, human papillomavirus vaccine. Drug class, vaccine, prophylactic immunologic agent, antiviral vaccine. Drug forms, suspension for intramuscular injection IM, comes in pre-filled syringes or single-dose vials. Brand names, Gardasil 9, non-availant, protects against 9 HPV types, 6, 11, 16, 18, 31, 33, 45, 52, 58. Gardasil, quadrivalent, discontinued in many countries, covered HPV type 6, 11, 16, 18. Cervarix, bivalent, also largely discontinued, covered HPV type 16, 18. 2. Definition. The HPV vaccine is an immunization used to prevent infection caused by specific types of human papillomavirus, which can lead to genital warts, cervical cancer, and other HPV-associated cancers. It is a non-infectious vaccine made using recombinant DNA technology that forms virus-like particles, VLPs, to trigger immune response without causing disease. 3. Mechanism of action. The HPV vaccine contains virus-like particles, Vs, derived from the L1 protein of the HPV virus. These VLPs mimic the structure of the virus but contain no DNA, making them non-infectious. When injected, the body recognizes these particles as foreign and mounts an immune response by producing neutralizing antibodies. If the person is later exposed to actual HPV, these antibodies prevent the virus from attaching to and entering cells, thus blocking infection. 4. Uses. The HPV vaccine is used to prevent cervical cancer and precancerous lesions, prevent genital warts, prevent anal, vulvar, vaginal, penile, and oropharyngeal cancers. Protect against HPV types most commonly linked to cancer and warts. 5. Indications. Routine immunization. Girls and boys aged 11 to 12 years can be started as early as age 9. Catch-up immunization. Individuals aged 13 to 26 years who haven't been vaccinated or completed the series. Shared clinical decision-making. Adults aged 27 to 45 years may receive the vaccine based on risk factors, e.g., new sexual partners, immunocompromised status. 6. Contraindications. History of severe allergic reaction, anaphylaxis. 2. A previous dose of the vaccine. Any ingredient in the vaccine, e.g. yeast, for Gardasil. Pregnancy. Vaccination should be postponed. Moderate or severe illness at time of scheduled vaccine. 7. Precautions. Before taking this medicine, tell your healthcare provider if you are pregnant or breastfeeding, have a history of allergies to vaccines, latex, or yeast, have a weakened immune system, e.g. from HIV/AIDS, cancer therapy, are taking immunosuppressive drugs, may reduce effectiveness, have a bleeding disorder, e.g. hemophilia, or are on anticoagulants, risk of bleeding at injection site. Chart 8, how to use. Administered intramuscularly IM, typically in the deltoid muscle, upper arm, given by a healthcare provider under aseptic technique. Do not inject intravenously, intradermally, or subcutaneously. 9. Dosing information. Ages 9 to 14 years, 2-dose schedule. First dose, day 0. Second dose, 6 to 12 months after the first. Minimum interval, 5 months. Ages 15 to 26 years or immunocompromised, 3-dose schedule. First dose, day 0. Second dose, 1 to 2 months after the first. Third dose, 6 months after the first. Minimum interval, 1 month between first and second, 3 months between second and third, 5 months between first and third. 10. Missed dose, overdose. Missed dose. No need to restart the series. Simply resume the schedule as soon as possible from where it was left off. Overdose, not commonly reported. If multiple doses are accidentally given or an overdose occurs, notify your healthcare provider, though serious harm is unlikely. 11. When to stop or avoid taking. Avoid or delay taking the vaccine if you have a severe allergic reaction to the first dose, you are currently ill with a moderate or severe infection, e.g. high fever, you are pregnant, defer until after pregnancy. 12. Side effects in detail. Common side effects, usually mild and resolve quickly. Injection site, pain, swelling, redness, systemic symptoms, fever, headache, fatigue, nausea, dizziness, muscle or joint pain, fainting, more likely in teens. Uncommon side effects: rash, itching, gastrointestinal discomfort. Serious side effects: very rare: anaphylaxis, Guillain-Barré syndrome, GBS, extremely rare, severe allergic response requiring emergency treatment. Note: fainting after vaccination is common in adolescents. It is advised to sit or lie down for 15 minutes post-injection. Top 13 vital information. HPV vaccine is preventive, not therapeutic. It does not cure existing HPV infections or lesions. Best administered before sexual activity begins. Pap smears and routine cervical screening should continue after vaccination. The vaccine does not protect against all HPV types, so safe sexual practices are still important. High efficacy, over 90%, in preventing targeted HPV infections and cancers when the series is completed on time. Title 14. Drug interactions. Other drugs that may affect HPV vaccine: immunosuppressants, e.g. corticosteroids, chemotherapy, anti-TNF agents, may reduce immune response to the vaccine. Live vaccines can be administered at the same time or spaced apart. Consult provider. No known interactions with oral contraceptives, antibiotics, or common medications. Always inform your provider about all medications and vaccines received recently. Thank you. Have a nice day.